All right. Good morning, everyone. Hope you're doing well. So nice to have you here for this discussion of inflammation. So, everybody pretty familiar, right? If you twist your ankle and that thing swells up, it's tender, it's swollen, there's pain, we get that there's inflammation there. So, what we don't appreciate though is that the same inflammation that is driving swelling in response to an injury is the same inflammation that is driving response to many things in the body, like an infection, like the chronic inflammation that can be happening in the background that we're not even aware of. So that's where we're going to go in this talk, and how fasting and so many lifestyle processes can get us into a space where we can minimize and rid the body of that. So fasting, inflammation, chronic disease, the big picture. We're trying to help everybody lose any weight that you want to lose, reduce inflammation in the body so that you can feel better and optimize health. So let us dive into it. As I've done before, feel free to throw questions in the chat. I can see Jen is here. Good morning. We're going to roll through it. I'll keep an eye on that. Sometimes I get in a zone and we'll just hit everything, and then we'll have a big discussion at the end, and maybe I will key in as we go along with questions as well. So starting out, just since this feels like, sometimes I'm presenting at an academic conference, a medical conference, I always give disclosures. So I just want anyone who's coming through here, so I don't really have any conflict of interest. I don't own stock in any medical or pharmaceutical companies. I don't sit on the boards of any medical companies. The only things that I have that are medical related, lose weight for free process. This is part of that, simplefasting.com. I'm medically licensed in Wisconsin. I've been a primary care doctor, was a primary care doctor for 12 years here in Wisconsin. And then I'm focused specifically helping people get rid of type 2 diabetes, lose the weight they want, optimize health. And then specifically for type 2 diabetes, I've launched an educational program. So I have one product I'm selling, all right? And it's this educational program, Dr. Z Method. So if someone you care about has type 2 diabetes, very thoughtful, innovative program there. So that's who I am and what I'm doing. All right, let's dive in. So in this little talk, when you leave this presentation, I want you to understand, okay, what is the role of inflammation in the body? What is it really doing? We just say inflammation is happening, but what does that really mean? All right, I want you to know and understand it. And then see the way that chronic inflammation in the body can lead to disease, because we get acute inflammation, we get sick and we get a fever, we get that there's inflammation happening. But, I think in the medical system in general, we don't pay much attention to chronic disease and chronic inflammation, and the fact that it's underpinning so much of the difficulty that we're having with health in our society these days. And then I want you to understand, okay, fasting and quote unquote diet, because to me it's the same thing. Everybody should be eating healthy food. How does diet impact inflammation? It's amazing that it profoundly impacts it. And then fasting is just the other side of our healthy eating. We have spaces where we're eating healthy food, and we have spaces where we're giving the body a break so that it can process everything and bring everything back into balance. How does that lead to impacts on the inflammatory state of the body? And then I want you to leave with practical steps to implement anti-inflammatory practices in your life. So I hope it's a real tangible, positive message that way. Okay, so what is inflammation and why should I care? So I will just say, as we're going through this, I'm going to go through a couple, academic articles. The immune system is incredibly complex. Inflammation is incredibly complex. There's all kinds of chemicals and names. I'm going to share some of that, but there's no quiz, okay? So you don't have to feel you don't have to take notes. It's all, being recorded. You can go back and listen, but you don't need to remember this stuff. I'll show you the actual technical things just so that we can talk about it. You kind of get the flavor of what is happening. So Inflammation is a function of the immune system. Even you twist your ankle, right? The immune system controls the process that releases inflammatory markers into the bloodstream, into an area. And so pretty much always when we're talking about inflammation, we realize, okay, we're mediating with the immune system. And the immune system's goal is protecting the body, preserving the integrity of the body. So we think about this as, an infection is coming in. So we get a fever and we feel all crummy. We get a wound, bacteria getting in, where the immune system fighting a battle. So we get inflammation is happening there. Body is responding to some sort of threat to kind of call in the troops and protect itself. So it can be triggered by many different things, infection, trauma, and here's the crazy one, and where we really intersect, I think, with where we have been discussing on the channel, is that stress itself can be a trigger for inflammation. And how crazy is that? We think of stress and emotions, right? Oh, that's all in my head, right? Well, it's in our whole body, and this thing is an integrated system. And so we can trigger these same inflammatory processes through stress, and we're going to dial in how that happens. So think of inflammation like a siren, like a warning call. It's like the body is calling for help and is trying to organize and coordinate a response so that we can deal with an issue in the most effective way. Okay, so why should we care about this? We get acute inflammation. This is the easiest to understand. Sterilize the infection, heal the laceration, right? We're bringing in the troops to kind of take care of this acute problem. The ankle swelled up, body called in the process, and then it calmed back down, and then in the perfect state, then it goes back away. So compare that with chronic inflammation, something that you can't really see so easy to see when you have an infection, when you have your ankle swelling up, right? Chronic inflammation, harder to see, and it's not really a normal state in the body. We'll see in the coming slides. The inflammation is supposed to be in a cycle. It's supposed to kind of rise up and come back down. And so if it is always smoldering along, you say, well, that can lead to dysfunction in the body, and dysfunction manifests as disease in the body. So we'll say there's many different chronic diseases, hundreds and hundreds. You look in a medical textbook, you say, oh, these are all discrete diseases. But what I want you to see is that underpinning most chronic disease is actually inflammation at the core of some kind. And yeah, so we want to get to that base layer, see what's really happening so that we can prevent it and deal with it in effective ways. So here are a list. Here's some conditions that are downstream of inflammation. So all autoimmune diseases are inflammatory conditions. They are conditions where the immune system is using this inflammatory pathway in a self-destructive way. So lupus, Crohn's disease, ulcerative colitis, rheumatoid arthritis. Also osteoarthritis, so we're going to talk about this, an inflammatory condition. Inflammation happening in the joint. The inflammation is what starts first. Obesity itself, we're going to dive into this, is both driven by and a driver of inflammation in the body. So of course, this is a big thing that I'm trying to help people unwind. And type 2 diabetes, at its core, an inflammatory process in many ways. Cardiovascular disease, even depression and cancer, it's just inflammation is the root of so much dysfunction in the body. What I want you to see, inflammation is a universal response. And this is why it can affect so many different things in the body. And it's also everywhere in the body. It can manifest in specific places, but the actual inflammation is controlled in many ways centrally through the brain. It's flowing through the bloodstream. So happening throughout the body anytime there's inflammation. This is why so many things can improve when we focus on reducing inflammation. It's such a core process. So I'm going to take a lot of time here and look into this paper from Frontiers in Medicine, which I think is very fascinating. Inflammation nature's way to efficiently respond to all types of challenges, implications for understanding and managing the epidemic of chronic disease. This is a very thoughtful paper. I'll get a link to it in the description after the program. All right, so here's an image from the paper. No quiz, like I said, but I just want to show you. Here's a scale. So there are chemicals in the body called cytokines, pro-inflammatory agents. Here's the scale, pushing things in favor of inflammation. And then there's some key ones that we'll come back to. TNF-alpha, a key inflammatory driver. IL-6, very key. CRP you might be familiar with. Maybe you've had a CRP measured on a routine, blood counts. And then we have anti-inflammatory agents trying to keep the system in balance. And you'll be very interested perhaps to see cortisol on the list of anti-inflammatory agents. In the ideal functioning of the body, cortisol, we think of, right, as stress hormone, right? It's actually trying to bring the inflammation back into balance. And then we'll see here how that can go awry. Many different inflammatory pathways in the body, the biggest or most powerful, this one called NF-kappa B. You don't have to know it, but you'll just see it when we're talking about it. So body uses lots of different pathways to coordinate its response, and NF-kB is driving inflammation at kappa B. All right, so what this image is showing, we've got the brain, we've got all these connections which are showing pathways between the brain and our immune system, which is wild. We don't think of the brain communicating, but it definitely does. Here's all the spots where our immune system is really located: in our bone marrow, in our lymph nodes, the thymus and liver and spleen. And so feedback is happening between the brain and the immune system, especially look at this one, sympathetic nervous system, if I can get my arrow going the right way, sympathetic outflow, hitting the adrenal gland, driving adrenaline, and that's tipping things in the pro-inflammatory state, right? And then if we look at this loop, adrenaline driving the forward part of the cycle, cortisol supposed to be inhibiting that as part of a feedback. And then we've got the other side of the system, parasympathetic outflow is supposed to be counterbalancing that effect. So remember, we've said the immune system is driving the inflammation. We can have things pushing on the pro-inflammatory side of the equation, and we can have pathways driving on the other side to bring it back into balance. The trouble is, when we are in a state where we are always sympathetically activated, right? When we're always driving the fight or flight system, we're not exercising our parasympathetic system to bring it back into balance. We end up developing insensitivity to cortisol. We essentially burn out the counter-regulatory mechanisms. We aren't practicing the parasympathetic flow. We're burning out cortisol's ability to keep things back into balance. And this is the pathway where we get into chronic inflammation. This system gets stuck in an always-on state where it's not really fighting anything exactly, but then it's kind of always on and smoldering, and we get these elevated levels of inflammation, which we said is a whole body response, and we end up with inflammation throughout the body. And then that is what sets up the process to head in this chronic disease pathway. So here I'm going to go through, quickly as can be for us, some specific examples, condition-specific examples. Let's start with obesity. This is what I want to help people, the most to get rid of. All right, so adipose tissue, that's the medical word for like fat cells, produce in and of themselves, inflammatory cytokines. This is what I was showing you on that slide. The pro-inflammatory, tipping things on the scale toward inflammation, TNF-alpha and IL-6. It's pumping these out into the bloodstream. And so I reviewed a number of studies this week, a number of them showing people with obesity have greater inflammatory response to a stress. How would you like to participate in that clinical study, right? Get in a lab and they're just stressing you and studying. Doesn't sound fun. All right, and And the higher weight that people are carrying, the more inflammatory markers people are expressing in response to a similar amount of stress. And so this situation sets up a very difficult cycle in the body. And this is what we're trying to unwind. We want to break this cycle, run it in reverse. We have inflammation in the body. This is driving obesity. This is creating the stress reaction that leads to this inflammatory cycle. And you can see it just spins around. So we have to unwind that. We break the inflammatory cycle. Here's a picture of it. And we don't have to go through all the deals. Here's some fat cells, right? Adipose cells. They recruit through complex things. This MCP1 protein is basically calling in the immune cells. They come and basically populate it. The immune system is coming in to the adipose tissue, making all the cytokines. Here's the cytokines, like we were saying, driving obesity. But look at all the other downstream effects. Producing the TNF-alpha, the IL-6. It's communicating with the liver, causing increased gluconeogenesis. That's telling the liver to start pumping out sugar, right? That's what starts driving insulin resistance. Other pathways that these inflammatory markers interacting with the insulin receptor, driving insulin resistance. One of the ways that they're showing on this chart is that that's leading directly to the development of reactive oxygen species. Reactive oxygen, I don't get too much into it, but this is like free radicals that can damage and inflame tissues and lead to cardiovascular disease. Also can lead down into type 2 diabetes. So this is the process we want to get upstream of. As we're losing weight, all right, we can decrease the amount of this inflammation that is happening and driving these processes. We absolutely want to do that. So cardiovascular disease, I was mentioning, I just run you quick through it, especially refined carbs, this reactive oxygen. The reactive oxygen, okay, we breathe oxygen. We need that to run the conversion processes in our cells that make the energy that we actually use. And when we're running lots of refined carbs through, all those mitochondria in the cells is what's making our power. They can start spinning off these reactive oxygens. They can actually break down. We get dysfunctional mitochondria. And this can oxidize our LDL. So we think a lot with heart disease, right, about our LDL. What's your LDL level? But we don't think about like, oh, are you oxidizing it, right? Like so many layers to it. Endothelial dysfunction. So endothelium medically, that's the lining of the blood vessels, all right? And this can cause inflammation. And then the end result of that, the oxidized LDL, here I should just show the picture, can get into the blood vessels, cause these foam cells. So macrophage, an immune cell, invades the wall of the blood vessel, tries to eat up the oxidized LDL and causes atherosclerosis. So this whole process, whoever thinks of atherosclerosis or vascular disease as an inflammatory disease, but we need to start seeing it's a chronic inflammatory vascular disease. And it's triggered, by diet and inflammation. Here's the picture of it. So here's one of these macrophages I'm saying. Here's the plaque developing in the artery. Look, it's all full of immune cells. The immune cells are invading in to try to get this oxidized LDL. They eat it all up, and they end up just blowing up with oxidized LDL. They liquefy, and that's what forms this plaque. As they're doing that, look what they're spouting out. TNF-alpha, IL-6, the inflammatory mediators call in all the other immune system. Then T cells come in, start busting this up. The plaque itself becomes inflammatory. The immune system can break it open. This is how you get a plaque rupture. This is inflammation is driving this entire process all along the way. Osteoarthritis, I mentioned. Okay, look, here's the joint. Here's a knee joint, right? And look, let's get into the knee and look what's happening. Look what is in here. TNF-alpha. Okay, you don't want it in there. But TNF-alpha, IL-6, it's binding to chondrocytes, the lining of the joint. And look what it's driving. NF-kappa B, which we said was this primary driver of inflammation in the body. And so if you are creating, okay, the joint fluid, which you have to realize the joint fluid is in communication with the bloodstream. Basically, the body filters out the blood cells and the rest of stuff flowing into this joint space. So you got systemic inflammation is flowing into the joint space. And so you can see that can manifest as this process, osteoarthritis, where it's hurting the cells that are rebuilding the lining of our joints. And we can end up, this is how, have you seen an x-ray of osteoarthritis? You're getting bone spurs and the lining breaks down, driven by inflammation. So everybody knows, right? Okay, losing weight can help with osteoarthritis. What's probably true about it, and what you should be able to see, let's look at it, is that it's the decrease in inflammation that helps osteoarthritis even more than just losing weight. Like, right, you lose weight, you say take the pressure off the joints. That's real, that helps. You don't have to load, so much pressure on the knee. But it's because we're losing weight, it's actually bringing down the inflammation that is driving the inflammatory process in the joint. This is what I want people to see. And this makes so much sense because you switch people into some anti-inflammatory process and the joints will feel better even before people lose weight. And that could be a medicine, right? You take an anti-inflammatory, you get on an NSAID, you can feel better, temporarily, in a couple hours because the inflammation is gone. You didn't lose any weight. Okay, so it's the inflammation that is driving the pain and the process. And what we really want to do is say, well, don't just take an NSAID, right? We don't want to just paper over this process. What is the root level where we can get and stop the inflammatory process, like at the very start of it? That's what we want to get to. And okay, so inflammatory bowel disease. Now I want to start transitioning with this paper into like how fasting is getting into the mix with this. So inflammatory bowel disease could be ulcerative colitis, Crohn's disease, autoimmune attack on the bowel. So this paper, effect of intermittent fasting on immune parameters and intestinal inflammation. Here I'm just going to read from this intro section. Fasting has been associated with the prevention and improvement of diseases, including inflammatory bowel disease. This review summarizes 20 animal and human studies on the influence of fasting on intestinal inflammation. Fasting improved histological scores, inflammatory markers, markers of oxidative stress, that's the reactive oxygen, as well as the microbiome. So fascinating study. I'll get a link to this also. Here's the slide that I took out of the paper. So IF, intermittent fasting, I just say fasting of some form. Here I want to summarize. Here's just the brief outflow. Okay, through the increasing ketones that are happening, that is having an inhibitory effect on these growth factors that is leading to intestinal epithelial regeneration. Just saying it's letting the lining of the intestine regrow. Like if you look, you do a colonoscopy, you look at someone with ulcerative colitis, just literally ulcerating, opening up of the bowel lining. Okay, you want to heal that, right? Epithelial regeneration. Fasting, through its increase in NAD production, interacts with this, get my arrow right, incredible group of proteins, SIRT proteins, that have inhibitory effects on NF-kappa B. Remember, we said this is the main driver of inflammation throughout the whole body. So here's a direct link. They're outlining fasting flowing through these proteins to reduce oxidative stress and block the primary pathways that are, creating TNF-alpha, IL-6. So some of the most potent medicines that treat autoimmune disease, TNF-alpha inhibitors, right? So we got a fasting effect that is doing the same thing as a biologic pharmaceutical product. Isn't that incredible? Flowing out through fasting's drop hormonal effects, one of which is dropping of IGF-1. This flows through into the mTOR pathway. mTOR is an energy sensing pathway in the body. It has effects throughout the body, but it definitely interacts like NF-kappa B with driving inflammation. And so this is interacting with the T cells. So not to go too deep, but the Th1 and the Th17, those cytokines are telling the T cells like attack mode. And so as we're creating the environment, Th1, Th17, it's like go attack, go attack. But when we upregulate this T regulatory process, it's more like telling the T cells, like, hey, just chill out and be nice and just like help out. And so this paper is outlining these ways that fasting, now this paper is focused on inflammatory bowel disease, but I've tried to show you what we've been talking so far. Inflammation is happening everywhere in the body. And also these processes like fasting, you know, or a medication too, like you take a TNF-alpha inhibitor, it's working everywhere in the body, right? These processes are bringing down inflammation globally, and then that can have specific effects where the body is struggling the most. Okay, so I reviewed, I don't know, 30, 40 papers for this. And when you do a PubMed search through the medical literature, when I'm typing in, fasting and inflammation, this stuff, the very most recent paper, this paper just published like 2 months ago, it is specifically on longer fasting, which is not really what I dial in with people on. But because, like, if anyone is going, from this, they want to, research or something, this is one of the top ones that'll come up. And I think it's very, very interesting. And so I wanted to spend a little time diving into it just to kind of tease out some of what is happening. So longer term fasting and its influence on inflammatory biomarkers. Now, when I started reading into this, let me see. Oh yeah, here we go. Here's from the introduction. So I started reading this and I said, Despite the rising popularity of prolonged fasting, its biologic effects and potential risks remain unclear. With claims suggesting it reduces inflammation, this review examines the impact of prolonged fasting and their definition greater than 48 hours on key inflammatory biomarkers. CRP, IL-6, TNF-alpha. See, you're an expert now. You understand that these are the primary mediators of inflammation throughout the body. Systematic search, 14 studies. Contrary to popular belief, the majority of studies reported either no change or an increase in inflammatory biomarkers during prolonged fasting. So I read this and I was like, oh, like what? That's, I was not expecting that. I was expecting to see like, oh, is it just super clamped down? Because we just went through the shorter studies, which are referenced in this bowel disease paper. You're saying, okay, we've got all the pathways mapped out. We're calming down this inflammation. Now we're sitting here in a space. We got this paper, which I think is great, showing these longer term studies saying, is inflammation increased? And then is that, what does that mean? Okay. Anytime like you read an abstract, you're saying, what is this really meaning? Like just read the paper. Okay. So that's what I tell you. I won't read this whole paragraph, but let me paraphrase. It basically is everything that I've said in this talk. Chronic low-grade inflammation driving age-related disease, central biologic process, driving pretty much all chronic disease, type 2 diabetes, liver disease, autoimmune disease, cardiovascular disease, neurodegenerative disorders like dementia. So the paper totally on board. Okay, the inflammation is driving all this stuff. TNF-alpha and IL-6, excessive adiposity, well established. Okay, so the paper showing, confirming, supporting everything that we have said so far, but then saying, okay, but is this longer fasting actually driving some of that, and what does that look like? So what did they actually do? This is what I want to show you. What did they do, or what did the papers that they reviewed do? So this table is listing all of the studies that they reviewed as part of this assessment. And so let's just understand what they did. So here's the impact on CRP that they're showing. So fasting for 3 days, no change. 3 days, no change. 3 days, no change. Then we get out here, 10 days, inflammatory markers increased in the majority. And then 10 to 20 days fasting, inflammatory markers increased. Now, I have many thoughts about this. It's very, very interesting. We have short-term data showing fasting decreasing inflammation in the body, and that's not this. And so in the short term, I can just say this process actually maps a lot of what I was talking about a while back when we were doing the metabolism, which is that you start introducing small amounts of fasting into a routine, you can increase the metabolism, which is something we very much want to do, like a jump start and a boost. The data that goes out, past 10 days, the metabolism can start slowing again as the body is going kind of back into a conserving sort of mode. This is it doesn't mean you can't continue to lose weight that way. It's just that the boost that you're getting is less for the amount of time that you're spending. And so this is one of the reasons why I always say simple fasting, which is like, okay, get the most bang for your buck, with some short-term fasting within a day or 1 day or 2, right? And that's kind of like, usually I say alternate daily fasting, kind of the end of simple fasting, and then we're moving on toward like advanced fasting. And this here, they say greater than 48 hours, but they're like 3 to 20. So this is like advanced fasting, right? So it could be the same sort of dynamic could be happening here with inflammation. Are you having some anti-inflammatory effects are happening in the smaller amount of fasting, but then does it invert? And then as you head out later, does it change? Okay, so that appears to be the case. I mean, I don't really question this. I think it's an interesting thing. Now, the other point I want to make about it is, from my perspective, when I dig into these papers, I say these people aren't really fasting. And so this is something that, as I read fasting medical literature, is so hard to get people into a fasting mindset. To me, fasting means nothing. It's like the definition. Fasting is not eating. And so to have a study where someone is eating, then they are not fasting. And I'll tell you, it's very rare that you actually find fasting studies where people are actually fasting. And that's true in all these. If you look in these columns every day, they are having fruit juice and vegetable broth. And you say that's like a certain type of fasting. People might call that fasting, but for me, for pure technical purposes, not fasting. I put out the video the other day, fasting aids. Okay, it doesn't mean people doing stuff like this are being unhealthy or that they can't lose weight. I'm just saying it's not pure fasting. You can use a fasting aid to help you fast, but it's not pure fasting, right? So for someone doing a scientific study, I would really push back on this and say, we aren't necessarily getting the pure effect of fasting. So that's like in all of these studies. It's very low calories without fasting is giving this effect. Now, maybe it's the same, but we don't know. And that's a point that the authors make in here, is these are tiny studies, non-randomized, and we have very little data on what is actually happening here. So just to be aware, we may not even be studying pure long fasting in these studies, but we still can glean information from it. Another point that I want to make about this is nothing about these studies saying, okay, 10 days out, there's now inflammation here again. Nothing in this data, and the authors agree with this in the study, says that that is a bad thing. And so what I'm trying to show you in this talk, we have inflammation in the body. Inflammation is a core process. It's essential to life. And acute inflammation, right, is how the body protects us from disease. It keeps us from getting infections. It helps us to repair injuries. It's just completely essential. Chronic inflammation is something that is very detrimental, and we've seen how, okay, that can manifest in all these different ways. Here is something very interesting. Now we are getting into a longer fasting state, and we're seeing inflammation come back. But just think about it. It's controlled by the body. The body is driving this inflammation, and we're not under attack. And what is the body actually doing? See, to me, this is purposeful and intentional the more that I think about it. They do comment in some of these papers that I read, the inflammation that is present is primarily happening in the body fat of the people, and there's more inflammation, the participants in the study, the higher the weight of the individual who is participating in these studies, the more inflammation the people have on biomarkers like CRP, the longer they fast. And to me, this just seems like the physiology that's happening. These people are reaching deep autophagy in the body, the deepest possible levels of autophagy. The immune system is going into like hyper cleansing mode and also hyper energy extraction mode. They're liquefying the body fat. They're releasing all the energy to power the system. And it makes physiologic sense the more I've thought about it, that this is actually what deep autophagy looks like in the body. So I thought this paper was fascinating to see that other side of it. It's the first time I've seen this type of data, but it is really giving a good perspective to me. Okay, we want inflammation used by the body in the most appropriate ways, and we want to minimize the chronic inflammation that is so detrimental. And I think this is helping to kind of lay out the landscape of what inflammation is doing in the body. And what I would say with a paper like this, the authors in the paper, and I would agree, in a multi-trillion dollar health system, can we actually just like really dive in with some studies that are more than 10 people in an observational study? Yeah, I agree. We need a tremendous amount of research across all of this. And the fact that we don't have that, I think, is very unfortunate. The good news is that you don't have to wait 20 years for some randomized controlled trial to figure out how you should move forward. How many times a human being eats in a day is a personal decision. It's something you can talk about with your medical team. And if you decide to try it, sometimes someone gets sick. You're running an inflammatory process because you're under an illness and you don't eat. You got the flu. You got something you didn't eat. You never called it fasting. You were just sick. Okay, the body is powerful. The body is strong. You can handle a fasting interval during a time when you are ill. How much more can you handle it during a time when you are well? It's the body, when the body is strong. You can just try these things out and see, can you feel the inflammation coming down? You can, many times. Oh, how did I do that? That's my thing from last week. There we go. All right, everyone has these systems that I'm talking about. We all have cardiovascular systems and joints and GI tracts, right? We're all trying to keep our weight in a healthy place. We can all benefit from reducing inflammation in the body. So how do we do it? Let's move in an anti-inflammatory direction using as many good and natural processes as we can. Oh, stop smoking. I'd meant to mention that in there. Okay, smoking, put the inflammation right into the body, stuff like that. Don't bring toxins into the body, a great way to avoid inflammation. All right, thoughtful activity, right? I like some of the papers I was reading are just calling it leisure activity. Just if exercise is too stressful, I'm not going to go to the gym. I'm not exercising. I'm just having some leisure activity, right? Taking a walk, being active, not just going and working out for 45 minutes, but like gentle movement throughout the day and keeping the body moving. That has great effects for the microbiome. It also, in many studies, lowers systemic inflammation. So exercise, not just about burning calories, okay, which is great, it does, but it's like, how do we reduce that total inflammatory level? Another way to think about it, right? In some of the studies, inflammation exercise studies that I was looking at, exercise is about practicing switching off the sympathetic nervous system. So remember that picture I was showing with the brain and all the connection between the immune system, right? There is sympathetic outflow, right? There is adrenaline when we're exercising or being active, right? That's kind of amping things up, but also you do it and then you stop. And when you're active, and then you stop being active, that's a trigger in the body to trigger that parasympathetic outflow. Remember, that's what brings things back into balance. So it's like we're in this hyperstimulated world, like we aren't switching off these pro-inflammatory systems, right? How do you practice flipping it off? So exercise, a way to do it. Fully trip that switch on like it should be. It's good. We're amped up. We exercise. And then do you feel that after you exercise? You kind of feel more relaxed. Like it helps you bring the system back into balance. Everything about inflammation in the body is about balance. We want to balance out the appropriate use of inflammation with the anti-inflammatory state. So an anti-inflammatory diet, here is absolutely something to do. So we think, oh, eating to lose weight, eating to get nutrition into the body, yes, but do you think about it about eating to reduce inflammation in the body? Like here's a whole nother perspective. So traditional recommendations for anti-inflammatory diet is pretty much everything that I tell people. Focus on whole, natural, nutrient-dense foods. Limit processed foods, especially refined carbohydrates. You want to get rid of that. Focus on fresh fruits, especially berries, veggies, fatty fish, healthy fats like olive oil, avocados, nuts, seeds. People will debate, about grains. I think, whole grains people would typically put in an anti-inflammatory diet. Certainly, there are people who have a lot of trouble with grains, especially gluten, can drive a lot of inflammation. So grains is a spot where it's like, well, maybe not for some people. You have to be thoughtful about that. Also legumes, and then anti-inflammatory spices. So like turmeric and ginger, very anti-inflammatory in the body. Also cinnamon, garlic. And then fermented foods, kimchi, sauerkraut, kombucha. So yes, what we're eating, huge impact. Absolutely. Fasting, here I put my core fasting series. So fasting we've seen, for sure in small, thoughtful amounts, that can look different for different people. Might look like just not even knocking out a whole meal, but just opening up a few extra hours of space in a day where you can give some open space to the body and let it burn through the excess and have a little bit of those pathways like we were showing, starting to be active. Try to clamp down on the inflammation. Now, fasting can be opened up in successive process. Maybe eating 2 meals instead of 3, opening up more space, getting 16, 18, 20 hours without food, staying hydrated. Use a fasting aid if you need as like training wheels to get you to space where you can do it with water only. And then maybe eating 1 meal a day, opening up increasing amount of space, maybe fasting for a whole day. I outline that in this series on fasting levels. And then keeping our mental space in a thoughtful way. Okay, so we saw the stress, right, on that diagram is feeding back out. You say, oh, if fasting is taking you to some place where you're like adding stress, like to a space where you're burning out your cortisol, if you're not solving the inflammation, then a fasting probably not helping you too much. Like it's like fighting, right? So this is why this practice, from my point of view, needs to be stress reducing, stress relieving, because as we're reducing that stress and we're bringing the inflammation down, then everything starts flowing in the healthy way. That's what we're really trying to do if we're trying to bring down disease, feel better, right? Get the inflammation down as we're reducing our energy intake. Okay, technology. I just want to bring this up. So all of like the technology that we have, the screens, the distraction, the stimulation, this is driving sympathetic side of this all the time. All right, if we're always on the phone, if we're always like getting hit, okay, we're not getting that parasympathetic flow to balance things back out on the other side. And then that has huge impacts on our sleep. And if we're not getting sleep, then that is also a driver of inflammation. So we want to limit this sympathetic flow, balance it out with these beautiful practices: meditation, getting outside, breathing, mindfulness, journaling, gentle movement. These are the things that bring the inflammation on a long-term level back into balance. So do you use a screen time thing on your phone so you can see how much time am I actually doing it? I say, like, tune in to Dr. Z on the fasting space, but then give it a break, right? Take a break. Okay, so here's the anti-inflammatory lifestyle, right? Doing some disconnecting from the electronics, the stimulation, practice living in the present, right? Not being trapped in regret in the past, not being afraid of the future, just existing in a calm space in this present moment, finding peace and contentment. If you're finding that sort of space, you're in a parasympathetic flow. That means you're sending the message, right? Directly communicating to your immune system. Hey, chill out a little bit. Like everything's okay. No infection, no illness, no injury, everything fine. You can take a break, right? Don't be jamming out any of that IL-6, okay? No TNF alpha today. Just shut it off. Minimize the processed foods. Increase your physical activity to the amount that you feel better, never to stress it out. Prioritize sleep. Practice fasting in the most thoughtful and gentle way that brings an increased level of peace and contentment over time. And that's what we do on this channel. If you're new coming through, watch the archives, see the videos of this thought process, tune in coming weeks, right? We just talk about how do we practice fasting in a way that is not stressful, in a way that's making our life easier and helping to reverse that cycle. So in this obesity section, we said, okay, how do we reverse that cycle? Bring down the inflammation, help us lose weight that then triggers lower levels of inflammation in the body, help bring things back into balance. And then connect. There's a lot of literature on connection with community and that people who are actively connected to friends, family, healthy relationships have lower levels of inflammation. So connect here. Obviously, I hope we can replicate some of that. And then, of course, so important, connect offline. And just, especially if you can connect with people in this sort of mindset who are trying to move in this direction, saying, let's bring the inflammation down and let's move in a direction of health and wholeness. Okay, that Frontiers in Medicine paper, the way it concluded, I wanted to just share a little bit with you. Chronic non-communicable disease plaguing individuals' lives and the healthcare system. It's financially burdening everyone. The chronic disease is driven by inflammation as the chronic thread. There's an urgent need for healthcare professionals to migrate from a single organ system perspective to recognize that development of chronic disease is a signal that the patient's body is in a state of multi-system dysregulation. This shift requires a multi-pronged response to promote anti-inflammatory interventions at the lifestyle, coping, and physiological levels. This is like the vision of an ideal healthcare system. And I just think it's such an amazing, vision to say, what if we had a healthcare system like that? What would that look like? Here's what they say. A transdisciplinary team approach to patient care would aid a patient to develop and sustain an anti-inflammatory lifestyle. For example, a patient with their first persistently mild to moderately elevated blood pressure reading, or their just out of range blood sugar reading, should alert a health professional to the potential of chronic sympathetic activation, right? That their parasympathetic system is in withdrawal. It's not working. They're out of balance, right? Can you imagine? Like right away, recognize, hey, this is not the optimal state here. And it should prompt a discussion about psychological distress, nutrition, activity. And if this person is found to be into distress, can we help them, right? In an ideal world, they'd be connected with a health psychologist or counselor, maybe some sort of integrated nutritionist or health coach. Just help people, right? Get way upstream, get completely upstream. This integrated team needs a lead physician, one with a diverse background like primary care or general internist, to merge and synthesize the patient's distress as a whole person response. This just feels like a job description to me. This is what I want to do. I want to lead teams like that. That's the future healthcare system that I want and that I want to participate in, is something that gets so far upstream that we are preventing chronic disease wholesale. 2-3 generations ago, we had minimal chronic disease across the entire West. Now it's everywhere. I say we can get back to it, and this is the path to get back to it by getting to the root, getting the inflammation out of our body so that the body can function in the way the body's not designed to function in chronic stress. It's designed to handle acute stress and deal with it and then get back to a stable and balanced place where the immune system can just function on keeping everything in line. So I say we can get back to that. I say let's do it. I thank you for being here with me on this channel, which is my best attempt to push these ideas forward, help people do it. There is no health system like that. I wish the health system was like that now. And like I've said many times, there's many good aspects to the healthcare system today. And we need to look at the good. And so many good people, everybody trying to do their best. But, we're very far away from a system that helps people do what this beautiful article is saying. So let us move toward that. So those are my thoughts of the day on inflammation. What thoughts do you have about that? How does that sit? How is inflammation in your life? Do you feel like that is something that you struggle with? Are there conditions like this that you deal with? And do you have a thought about how you will move toward it? Does this presentation give you ideas or thoughts about how you might approach this situation in a way that helps you get the inflammation out? Pat is here. Good morning. Happy Sunday to you. Very nice to have you here. I hope you're doing well. I know my personal experience has been that fasting, I can feel it as an anti-inflammatory process. How old was I when I started leaning into fasting? Let's think about it. Early 30s. Probably must have been like 30, 32. My experience at that time, I've told this story a little bit on the channel. I put on a lot of weight during my residency training from eating unhealthy and chronic stress and no sleep. Very inflamed. A lot of inflammation happening. And I remember at that time, just for example, I was having joint pain. Holy cow. Especially ankles, knees, being on my feet all day. I remember sitting there in the year before this, thinking like, I can't believe I'm like 30 some years old. I feel like this. Like it just didn't seem right, but I had no idea what to do about it. I could definitely feel that effect as getting into the fasting. That's one of the things that went away for me was joint discomfort. I like talking about that osteoarthritis, like I talked about. Especially as a runner, people say, oh, run, but I don't want to hurt my knees. I don't want to, get osteoarthritis. What is really the cause of osteoarthritis? I want to be a runner personally. I want to be running until I'm very old. And in my early 30s, I thought, well, that probably can't be the case. If I already am having this pain, I always thought it was running. I mean, I was doing a ton of running because I was trying to lose weight and I was struggling with it. I was burning myself out, trying to run my way to weight loss and finding a lot of frustration. Then I found fasting. I lost the weight that I wanted to lose. And then my joints felt better. And then I could run more. So there's a virtuous cycle. That's what I want for people. Virtuous cycle in which everything health-wise going in the best possible direction. Really enjoyed this topic this week. Want to thank for the Good of Humanity viewer for suggesting that. I had been reading on some of it anyway when you suggested it, And so then I said, I'm just going to go turbo focus on inflammation and put this talk together. Really enjoyed it. And it just clarifies for me a few things, which is just how central it is to our health and well-being. And then that fasting, I think, more than anything, is about getting to that place. I've said a lot on the channel. My goal for someone is to find a mental space of peace and contentment more than it is for someone to lose weight. I'm kind of devoting my whole life to helping people lose weight and get healthy, okay? But even if someone never did that, if they got to a better emotional state, then I would say that was like a victory, right? If you're feeling better. And this is kind of in that same thing. Like, yes, we want to lose weight, okay, but why do we want to do it? Like, isn't like getting the inflammation out even the bigger root level? When you see that the drivers, it's not so much the weight in and of itself, it's this inflammatory state in the body. People say, I want to lose weight so I don't get diabetes and heart disease. Yeah, but like, how does it mediate? It's not just because you're carrying extra weight around. It's because of this very complex relationship with the immune system and inflammation. We want to get the inflammation out. Yeah, like we want to get some extra weight out. You can feel better doing that. We want to get the inflammation out so that it can stop all these different things. And sometimes people can struggle to find motivation. And sometimes you say weight loss, who doesn't want to lose weight, you say, but like you can struggle with motivation. Maybe the inflammation, say, I want to get the inflammation out. Maybe that is another pathway to kind of dive into to find some health motivation. R. Jones says, I started including intentional fasting in July. My knee pain has reduced significantly. I also sleep much better. Hey, I'm so happy to hear that. Thank you for sharing. Many people experience these sorts of things, not always in the short term, especially with the sleep. There's, sleep is complex. Someone start fasting and you change things. Sometimes it can be an issue there. But I will say that especially over time, as the practice develops, most people experience better sleep. I know I definitely experienced that personally. Can be, different ways to approach it as far as the timing of fasting with sleep would be something to look into. Most of the time, like my default place where I have people start is fasting in the morning is usually easiest for people because people are very content to have a coffee or tea, people least hungry in the morning. That's the easiest space. So fasting in the evening, more difficult because dinner is our more social meal. Not many people feeling bad missing a breakfast with someone, and you can also just have a coffee. So socially, it's like not difficult for many people. Missing dinner, people feel on a lot of social pressure to eat in different ways. So it can be harder to fast in the evening. Just something to work on, something to communicate with friends and family about. Fasting in the evening opens up a few interesting situations. One of which is if you're feeling hungry, it can be harder to sleep. So that's like where I wanted to go with that. Yeah, if you're trying to go to bed and you're just hungry and your stomach's growling and you're like, oh man, can be hard to sleep. My experience practicing fasting is that gets easier. And as you start to recognize that, oh, this is a pattern in the body's just used to this eating now, and it prepared all of these digestive processes so that I can eat now, and then I'm not doing it, and the body's like, well, what do we do all this? And then we have to put it all away. You kind of breathe through that space. You just recognize, okay, physiology is happening in the body. Body is learning. This is what it's like, and you can always use a fasting aid, and you can always just eat something and say, I tried. And so if fasting in the evening is not for you, never stress about it. But where I want to dial in with this is, okay, we haven't appreciated how much work the body does for us in running our digestive processes. We eat something, we think we're done, but the body's like, oh man, I just got to clock a 12-hour shift here because the body's going to be working, digesting all of this. You want to get to the deepest levels of sleep where the body's like really shutting down. Okay, you want to be able to shut this system down from time to time. And so you open up some fasting space in the evening. Everything's kind of worked its way through. Body's like nothing going on here. You shut that system down. You can really get to a deeper sleep state using fasting that way. And then, other ways that sometimes people can't sleep because of acid reflux and other things. So you start opening up more fasting space in the evening. Can also help with sleep in that way. And then, the knee pain, the joint pain. That's what I was saying when we were talking about osteoarthritis. You take a medicine, an NSAID or some other process, and it's knocking out inflammation. You can feel better right away. You start embracing these natural processes. The body is incredible. The body has ability to do that without using a medicine, to bring down inflammation naturally. Many side effects to many anti-inflammatory drugs, not the least of which is increasing the risk of bowel diseases and stomach ulcer, other sort of things. So if you can get into a state where you can bring that inflammation down, then you have improvement there anyway. So thank you for sharing. Really appreciate y'all being here with me. Have a great week. Share thoughts on inflammation this week in the comments. I'll be happy to have an ongoing conversation with you. And I will see you back here next week. Bye, everybody.